So we all know why we're here today. These stats, I think, are not a surprise, unfortunately. It's the reality of what we see every time we go into a school, into an after-school setting, into a community service board office, right? We know that the reality of this is kids that can't find the care they need, whether it's because they're scared to ask or they just don't live accessibly near a provider. And so this is kind of what draws us to this work. I also know, I'm a social worker as well. The truth of becoming a school-based mental health professional or a social worker or a therapist is that it takes a lot of work, right? That our profession needs rejuvenation. And so we're looking at how we can creatively address the workforce shortages that we're seeing and really strengthen the pathways that help bring the right people into the field, right? The people that are passionate about community care, passionate about youth, passionate about really finding ways to heal a lot of the mental health challenges that we're seeing actively in our communities. From a workforce development lens, we know that the workforce today is already showing signs of suffering, right? Signs of struggle. And so when we look at the jobs EQ data, the active posts on job sites like Indeed and LinkedIn, we know that there is already an active need for more folks to join the care profession. And that while a lot of these do require some of those higher levels of education and credentialing, a lot of these are peer roles. So when we look at things like first aid certification being required across a lot of jobs, that's an attainable certification that we can go ahead and start equipping folks with so that they're ready for the workforce, right? So in addition to that piece about inspiring folks to join the workforce, we also want to consider what are the skill barriers that might be preventing folks from taking those first steps. We also, know that these are roles that play a really important role in those mental health challenges, right? So if we're talking about youth that are experiencing major depressive episodes and not able to find care, that's likely connected to the shortages that we're seeing in child and families and school social workers, right? And so connecting those dots, it's not a surprise to us that these two trends are running parallel to each other, right? That there's increasing youth mental health needs while there's also increasing needs in the youth mental health workforce. We also know that this is not a secret, right? All of us on this call are very familiar with these stats, with the conditions that our communities are facing. But we also know that outside of this room, that this is something that is relatively, well understood as kind of a spectrum, subjective, but that people know that this is an issue. Oftentimes in community conversations, it'll come up as one of the top priority needs. Kathy mentioned that we facilitate or operate the Virginia Community Engagement Index, which is a landscape study that looks at the pulse of civic engagement across the Commonwealth. And one of the things that we know from doing that work is that youth mental health is the #1 need that youth face. So for our respondents that are under the age of 24, they ranked mental and behavioral health as the top need that they were passionate about addressing. We also know that folks see service and volunteerism as an opportunity. So for those folks that are under the age of 24 that participated in the VCEI, 1 in 3 said that they volunteer as a part of a way to stand out on a college or a job application. So this idea of serving, interning while learning is, I think, already intrinsic to a lot of our young adults across the Commonwealth. And we just really need to find some creative ways to bring these 3 trends together. Bring this escalating youth mental health need, the escalating needs in the workforce, and then also this passion to serve, kind of finding a solution across those 3 trends. Like Kathy mentioned, Serve Virginia was grateful to receive a planning grant from the National Youth Mental Health Core Initiative that was a partnership of the Schultz Family Foundation of Starbucks, Pinterest, and America Forward, and AmeriCorps, the Federal Agency for Service and Volunteerism. The planning grant was awarded in March of 2024 for about 9 months. So if you're doing the math, we're coming up close to the end. And we've learned a lot over the past 9 months. Really, it has clarified our mission of the Virginia Youth Mental Health Core to do 2 things. The first is going to be to engage young adults, so young Virginians age 18 to 24, in service opportunities that are going to meet the critical youth mental health needs that we see evident today. We also want the Virginia Youth Mental Health Core to use national service models to build service to career or service to credential pathways that help equip these young adults that are serving in the Youth Mental Health Corps program with the training and credentials they need to be impactful members of the workforce tomorrow. It really is this dual focus that we think makes the Youth Mental Health Corps most unique and most innovative, because we're not only focusing on the needs today, but we're also building pathways that will serve youth tomorrow and for years to come, right? That these are not only pathways for young adults to join, but the youth that are being served by the young adults will be able to also utilize this pathway. And so we're building hyper-local avenues that folks can take to really see themselves as a part of not only a solution, but also a solution to a epidemic that they feel is really critical to address with their peers. So let's get into a little bit more about what this can look like. There is a service component to the Youth Mental Health Corps. So like Dr. Hazel mentioned, there's lots of kind of things to be determined around what members will do and what this will look like. But this is the serve part of the service to career pathway. Members are going to be engaged in service to their communities as a part of that learning experience. This is going to be designed for young people between the ages of 18 to 24 or 18 to 29 if they're serving in the peer recovery space. And they're going to serve across three kind of pathways of service. So some members will be focused on school-based mental health navigation. These are members that are going to be serving in school and out of school time with middle school and high school students, really focusing on how we can promote positive mental health for students kind of broadly, right? This could be everything from working with students one-on-one and in small groups around coping skills or de-escalation, all the way through to delivering curriculums in schools like teen mental health first aid or sources of strength, different ways that we can help use these members to really infuse positive youth mental health development into the school and after school settings. Other members will be focused on peer support and recovery. So this is across both substance use disorder and mental health recovery, but really finding ways to tie those peer roles into the services that youth are receiving. Oftentimes youth are seeking services at multi-age, facilities. So programs that are geared towards adults ages 18 and up. And so really focusing on building capacity for organizations to offer services specifically for youth in that age bracket between 13 and 29. This is an interesting way to flex out a near peer model. So it engages young adults in service to other youth and young adults, which we know is really powerful from our other work in the space. These members are also going to complete the peer recovery specialist certification training and experience requirements. So at the end of their term of service, not only will they have a year of experience in this work, but they'll also be able to reference their peer recovery specialist certification and sit for that exam. So we'll see a greater influx of more peer recovery specialists that are qualified and have experience and are trained entering the workforce as well. I know we've got a couple of folks on the call that are passionate about the peer role. And so there's people more qualified than I am to talk about the important role that they play on the treatment team. But we really see this as an important part of the mental health workforce, because not only is this an opportunity for folks with lived experience to really be able to make a tangible impact, but it's also a way to continue growing the workforce with more roles that don't require some of those higher levels of education. And then finally, the community mental health pathway is going to look at how to exercise the community health worker training and certification that we know is already working in communities to specifically help support youth and families that are navigating the mental health systems. Again, there are people way more qualified than I am to talk about the power of community mental health and community health workers. But just as a person that has been alongside a lot of community health workers in their work for many years, the amazing relationships that community health workers build with the communities that they serve position them perfectly to help support and navigate the mental health systems alongside youth and families. And so when we think about things like how do we decrease the stigma of asking for help, how do we help people navigate the existing resources and services, community health workers are kind of that natural next step. And so thinking about ways that we can help more young adults access community health worker training and experience was a no-brainer as a part of this program. And so folks will be able to receive the training and the hours required to become a community health worker, meaning at the end of their term of service, they'll walk away with all the things that they need to be that trained and capable community health worker and find a job as a community health worker in communities serving this important role. And so we're really excited by the ways members will serve across these three pathways and the vast amount of experience, capacity, and service that this will bring to our communities. As members are in service, like Dr. Hazel mentioned, they're also going to be receiving a stipend. So this is going to vary a little bit based off of part-time versus full-time and length of their service and things like that. But I did just want to mention members will earn a living allowance for while they're in service. So this is a paid opportunity. They will receive an education award at the end of their term of service, which again, can vary based off of the length of their term, but is specifically designed to help support them in their future endeavors, whether that's higher education, paying back student loans, credentialing, or seeking other training. And then also that as a part of this experience, they will be networking with one another. They will be accessing important training and resources to help kind of both continue in some specific pathways, but then also to really set them up with what they need to be successful as leaders in this field. And we're really hoping to see not only that tangible impact on youth in the community, but this long-term impact on the workforce as well. And then just to really kind of hammer it home, the main piece of this that we think is so important is the service to career pathway. So I just talked a lot about the service that they'll be providing. And we're also being really intentional about making sure that there are those career pathways pieces that are built into the experience of the program. So from the training that they receive before they're deployed into community, and then the time that they're spending in their service, kind of thinking about that training curriculum, really making sure that these folks are tangibly adding to the behavioral health workforce in meaningful ways. We're exploring how they can be credentialed as behavioral health technicians and behavioral health technician assistants. We're looking at how they can offer, in-need curriculums like teen mental health first aid and youth mental health first aid. We're looking at how they're going to be able to complete some of those really basic entry-level trainings and experiences to make them most employable after this term. And we know that this is going to provide a huge benefit to the communities that they serve and to themselves kind of overall. If you're a graph person, this is kind of the visual, right, of how all of this comes together. The Virginia Youth Mental Health Corps is going to be an umbrella of sorts that's going to include different programs that operate across these pathways. So for folks thinking, well, what are the requirements going to be, or what's this going to look like? Programs will have unique requirements based on the settings that they're serving in. So for example, members that are serving in school might have a requirement to come in with some, higher education, or might need to pass more background checks than a member that's serving with a youth recovery program. Members across these pathways are all going to earn credentials that are applicable to the settings that they're serving in. So whether that's a peer recovery specialist certification, the community health worker certification, or the certifications that we're building and credentials that we're connecting for the school-based mental health pathway, really making sure that we're focusing on the tools that are going to be most helpful for these folks as they enter the career field after their term of service. And then a little bit about the timeline. So between now and January, we're really looking at building out this model, talking to the folks that want to implement this in their communities, and connecting them and the model with the resources that it needs to be successful. So we're going to have a time for group discussion in just a little bit here, where we're really going to dig into these questions. We want to know what you think. We want to know from your experience kind of what dots need to be connected. What are we not seeing? And we'll talk more about that in a little bit. But just to kind of broadly say, we're looking at really growing the foundation for this program right now in the before times. That's what I like to call them. Starting in February, we're really looking at allocation of resources, right? So I'm going to talk a little bit about the infrastructure here, but looking at how we can bring in private funding, how we can leverage federal funding, potential state resources to really help make sure that this is a successful initiative. Resources are going to be sought, allocated, secured, and then in May, we're really looking to hit the ground running and start putting these models into practice. And programs will begin in September of 2025. Our goal is to start with at least 75 members. And we're really excited to kind of see how that can found some really interesting pilots and thinking kind of strategically about what this sets us up for in the future. A little bit about the infrastructure piece, because I know that this is one of the main questions folks have about an initiative like this, is how does this actually work? There's going to be about $1 million of AmeriCorps funding that is going to go to power this engine. So like Kathy mentioned, Serve Virginia is responsible for managing the AmeriCorps Virginia AmeriCorps state portfolio. And so looking at ways we can help use this as a funding priority and really gather folks around the resources that we can use to leverage and implement amazing, innovative programs like this. We're also seeking implementation funding from the funders that awarded the planning grant. So this is additional funding that can go towards increasing member living allowances, providing increased capacity for organizations that are implementing this program, really making sure that the settings are kind of rife with support for members and really making sure that this has the impact that we're looking for. And then finally, some folks in the room are maybe thinking about what role they can play from philanthropy or a funding perspective. This is going to be essential as we start thinking about how this is scaled and replicated across the Commonwealth. So really thinking about what can we pilot in this first year or two, and then thinking about really building a solid foundation so that as we think about goals like having youth mental health corps members in every county or having youth mental health corps members in every school district, that we really have the tangible support to make that happen, and thinking about kind of all the pieces coming together. So with that, I'm going to pause there and pass it over to Kathy to share some thoughts.
Thanks, Annalise. And that was a lot, right? And at the same time, I'm hoping everybody is kind of thinking this is a really unique opportunity for us in Virginia to leverage the fact that we have existing funding. We do have AmeriCorps funding. As Annalise said, approximately $1 million will be allocated to applications that are focused on implementing a youth mental health corps based upon the framing that we're here to talk about. And that those resources will go to organizations that in most cases today are already operating AmeriCorps programs, so they know how to do it. But also we're inviting new organizations who might end up with a planning grant to think about the following year. And so we're putting the scaffolding in place to implement the program with 75 members in 2025. But I really do hope that all of us imagine this at scale. And understand that what we're building today and what we're trying to frame and replicate as we move to implementation in 2025, it's not too early to be thinking about how do we envision this in every community in the Commonwealth? How do we leverage and build a model for success that builds on all of your core expertise and convenes a youth mental health corps to do tremendous work and to see great results and impact. And so I'm hoping that as we go to our conversations, because we really want to hear from you, we want you to believe that there's a commitment on the part of Serve Virginia and our AmeriCorps resources through the Virginia Department of Social Services and all of you who are committed to this cause to build something unique and different. We are learning from about 4 other states right now. I think it's 4, Annalise, that are currently in their first year of operations of a youth mental health corps. And so we'll be in this second cohort of implementation in the year ahead. When you imagine the resources of young people to tackle a problem that they're very aware of, it's just inspirational for me to imagine how we might design an initiative that uses the power and the potential of young people to address it and tackle an issue that they understand best. And in doing that, we inspire an entire generation to pursue behavioral health and public health as a career path and opportunity. So from my perspective, when you look at, we're talking at Serve Virginia about within 3 years, potentially doubling our entire portfolio. And what would it take to do that? How do we go from 75 members to 350 members in 3 years? That's the kind of thinking we want to seed for all of you, that we want to understand the granular pieces and put it together at the front end. But we want to see this scaling rather quickly. This is a challenge that we don't want to lose another generation. We don't want to lose another year. We want to get on this and build it and move it to scale as quickly as we possibly can. And so we're really open to hearing what you think our greatest challenges are going to be, what connections you think we need to make, what contributions to the thought leadership that the next part of our journey will require, and where you want to see a place to play. And so we're encouraging all of you to pair your passion with this purpose